introduce yourself.
Yeah, let's go for it. Hi, everyone. My name is Nicholas Franco, and I help coordinate the ACP Long COVID Interest Group. Thank you all for joining us. And today we have a wonderful speaker, Dr. Andrew Simon, who's joining us. And I will let Dr. Anita Chopra, the leader of our group, go ahead and take it away.
Thank you, Nick, and thank you for putting this together, and thank you for coordinating everything. Hello, everyone. Welcome to the ACP Long COVID Interest Group. Today, we are talking about something that's really important to me and actually is a huge gap in our knowledge as primary care providers, especially, which is integrative medicine and naturopathic approaches to long COVID management, as well as chronic inflammatory conditions. So I'm very, very excited to welcome today's guest. Our expert today is Dr. Andrew Simon. Dr. Simon is the founder of Rebel Med Northwest. He specializes in functional and integrative medicine approaches. In addition to that, he is passionate about community engagement as well as provider education. And his contribution to the Department of Health Power of Providers has been invaluable throughout these past few years as we have focused on long COVID. Welcome, Dr. Simon, and thank you for giving us time today.
Thank you very much. Yeah, I would say as a naturopathic physician, it's quite fun to, learn. I'm about 10 years into practice here, and I think the last couple of years, the rallying efforts around POP, the Power Providers Committee, and, finding opportunities to work on such a challenging moment for us all. I think we all have our personal stories to share. So I'd love to hear any questions or, throughout the course of this presentation. I've got some slides, but I'm more than happy as Anita has a few questions for me and facilitate a conversation. If any of you have worked with a naturopathic physician, I teach at Bastyr University, the teaching clinic for natural medicine here located in Seattle. So I have a background in exercise science and I'm board certified in biofeedback. So you'll see all the different angles that I approach, whether it's chronic inflammatory conditions or long COVID.
So I'm really excited, Andrew, for this today because I have spoken with you on multiple occasions about mutual patients or challenging patients that we saw in clinic. And what I really have enjoyed learning from you is the pathophysiology and how you really broke down long COVID and chronic inflammation to the cellular level. So I'm really hoping that we could give folks a glimpse into that sort of area of your specialty. So Andrew, can you, start off things by talking a little bit about the clusters of long COVID symptoms that you see in the clinic?
Yeah, absolutely. So it's really interesting. I mean, even today, I think it's one of those things. I had a couple clients today, and I had a client today that, otherwise very generally healthy, vegetarian diet, mid-40s, but yet they had the first time ever they had COVID this June, July. They had been very well vaccinated. They had, been doing the cautionary measures that we all advise. And even yet still, they, had a bout of COVID that led to subsequent, a random constellation of symptoms, but do show up in our, classic examples of potential for long COVID. Now she's only, pushing upon 3 or 4 months since her infection, but these symptoms that arise, clusters of stuff that can sometimes happen not right away acutely, but show up a month, 2 months, 3 months later, particularly I think due to the cardiovascular implications that we see with endothelial dysfunction. So, I have a huge cluster of patients that they get this like hypertensive crisis that shows up. Maybe they've never had hypertension before, and all of a sudden they're shooting up into the 150s over 90s. I had a couple of patients get into the high 180s, over 100, and and then it oftentimes shows up, particularly with the vulnerable patients that I see, when the individual is having an already stressful period of time in their life. Maybe it's a chronic stress in their work, a dysregulated sleep-wake cycle. My patient today, brand new patient today, she's got two, children that have special needs. And so her attentiveness is very much focused on, taking care of her children, but yet she gets this illness and she was doing the best to protect herself. But yet, sometimes our own children get us ill, and bring something home from school. And now, she's challenged because she's torn between her work life and her ability to take care of her children. And this really adds to, you'll hear me talk about, one of the core components of what I see that I get a lot of great results with is really addressing this, the psychoneuroimmunology implications of what our body goes through when we're ill or sick. Whether we look at it from the angle that COVID itself can cause neuroinflammation and subsequent changes to our mental health or our sleep health, or maybe those things already existed and it becomes a barrier to improving our immune health. So I see a lot of cardiovascular implications. I work with a lot of cardiologists. I want to stabilize from a safety perspective, of course, whether it's this, some of my patients have a supraventricular tachycardia or hypertensive issues. We put them on our medications that are necessary to help create safety and stabilization. But the downside of that sometimes is these great medications that help keep our system safe, they may lead to exercise intolerance. And we get into a situation where we start to see this spiral of, maybe if it's already paired with post-exertional malaise or some other factor like that. So where I intervene is really trying to say, what can I address from, all the angles, keep them safe, but can we help people rebuild that story back to where they feel functional, capacity again? I think, let me just show my slide. I think I have a great little intro to that. One of the other things I see repeatedly is this area of prior head injury. I've seen a lot of individuals that have had either prior TBI, concussion, some type of head injury. And, a little link here I just found the other day, as we continue to investigate this, I think it speaks to this bigger picture when someone is in a chronic inflammatory state and they have maybe a what we call a leaky blood-brain barrier, or we get this neuroinflammatory things happening. I see really prolonged effects with long COVID in my neurologic patients have a prior head injury. Like I said, I kind of alluded to the endothelial injury or dysfunction. We have a lot of patients that typically see a naturopathic physician or a gastroenterologist for some type of inflammatory bowel disease or IBS, or maybe they've had prior antibiotic use or some kind of dysregulated GI function, including SSRIs, and their effect on the microbiome. So you might talk to a lot of naturopaths that do a lot with microbiome health, probiotics. We know clearly in the data that we see a lot of chronic infection history, those individuals that have that EBV. I see definitely showing up with a lot of that post-exertional malaise, chronic fatigue, neuroinflammation type of picture. My specialty in mind body medicine and biofeedback, I happen to catch up on a lot of the mental health applications in primary care frequently. So we try to create our interventions there. And then, I've got patients that will have like already an underneath, autoimmune or mast cell activation syndrome. And so I really see a fire get started in any of these categories as a consequence of COVID. And that's where, I try to, create my interventions where I best can.
I think this is fascinating, Andrew, what you talked about. And I especially love the analogy that you gave about a fire. And truly, COVID-19 acts as a lighter fluid and, aggravates or wakes up underlying inflammatory issues. For example, people may have new diagnosis of rheumatoid arthritis or other such autoimmune conditions after they have had COVID and subsequent long COVID. From what I'm understanding, especially from this slide is, and we have talked about this in this group before, are the different clusters and patterns that we see. For example, cardiovascular, including unexplained tachycardia, including hypotension, including POTS-like features. But what I found really fascinating was the connection between the gut and the brain that you're talking about. Not only including neurological complications and cognitive dysfunction, but also psychiatric problems, which we see a lot in our patients. So this was my next question, Andrew. So it's related to your next slide, which is what is going on at the cellular level from your perspective?
Yeah, so I kind of jumped ahead here. One thing we see, this is a study that came out, I think, at the end of 2023, that demonstrated that the consequences of a SARS-CoV-2 infection leads to a decrease in dietary intake of tryptophan, and as well as many other amino acids that sometimes we use very specifically to help assist in our neurotransmitters, our gut motility, and so in this example, just to highlight that we need these things to help assist that highway that connects our digestive system to our brain. So we call this the gut-brain axis. And what I find is a lot of times this signaling in the GI tract. One of the slides I often use in my presentations with patients is this kind of slide, more looking at what happens with the pathophysiology of inflammatory bowel disease. But if I oftentimes, I'll give you kind of how I describe it to my patients. So I describe that, if we've got dysfunction here in the lumen of our GI tract, it could be a dysregulated, balance of the microbiome. It could be maybe factors that are disrupting this mucus layer. We a lot of times we'll hear people say, oh, I'm allergic to this food, or I don't tolerate this food very well. I have to re-educate a little bit that it may not be, an allergy. It just may be that there's something stimulating the GI tract in a dysfunctional way. Maybe we ask our patients sometimes when we're suspected of IBS to follow a low FODMAP diet. Well, the reason we do that is that those easily fermentable, disaccharides and oligosaccharides and fermentation products, they sometimes feed bacteria that release endotoxins into the system that cause then subsequently diarrhea. Well, what we need to know what's happening on the local level there is if there's been a disruption here, maybe a loss of this mucus layer, this protective shielding, we start to get immune signaling locally in these mast cells in the digestive tract, which then we saw in that last slide that gut highway, goes up to the brain. Well, we get these releases of histamine, and we get our cytokine storm. We get, these local things happening in our GI tract that our body tries to help us with, right? So we get diarrhea, or we notice a cramping sensation, or some even subtle symptom that starts to show up. I mean, this is why we look at what's happening in the sewer system to track our COVID levels happening in a society. Is it because there's this irritation, this factor playing a role in our digestive tract? So whatever it is that's in the GI tract that's bothering us, maybe it's a dysregulated microbiome. I try to pay attention to why that is. So maybe it's, if we think about, sorry, I forgot to put the citation on here, but we do see that, the local changes of a COVID infection release this cytokine storm, right? Those same interleukins, the TNF alpha, they themselves are causing the acute nature of COVID. But what we end up seeing is that we also get this, tryptophan, phenylalanine, glutamine, leucine, this ionic shift that happens from the lack or absorption of these amino acids. And we see that this as one signal that there could be something immunologically happening in our GI tract. And so that's why I really like to think about, what else is going on in this person's life. What are all the factors that lead to a dysregulated, GI system? So I mentioned earlier, if this mucus layer gets disrupted, if this microbiome gets disrupted, well, one of the factors that I see commonly is just purely, sorry, I can find my slide. Oh man, okay, where'd it go? Well, it's just literally their stress response. I was basically going to show up a standard, picture that shows, the sympathetic side versus the parasympathetic side. And what we see is that if someone is in that chronic stress state, um, they end up, not producing as much mucus. They don't produce as much stomach acid. They don't get the quite the enzyme release that normally would facilitate their digestive function. So we see the downside of that. And easy example, if you're stressed, you don't feel hungry, right? But if you're in a relaxed environment, you're in a calm space, you really practice your breath work, you start to smell your food, you try to tap into those mind-body medicine principles about facilitating healthy digestion. You chew your food all the way, you really make sure that assimilation is taking place. We tend to see a less of an inflammatory response because we're getting full and complete breakdown of our food. And it's not that food allergen or food intolerance is really the issue. It's really about how it's interfacing with our immune system. So a lot of times you get patients say, oh, I want a food allergy test, or I want a food intolerance test. I remind people that those things are just clues that maybe, yes, actively you're reacting to those things. But what I try to do is say, okay, what's deeper than that? Are you eating too fast? Are you, not really digesting your food? Because that's where that it has implications on that slide of triggering that immune response, that cytokine storm peripherally. And that's what I'm trying to get at, is that, whether it's that's why we use probiotics, or why we try to use digestive aids. You have people self-selecting these things. You hear about these stories online about people using apple cider vinegar or lemon juice, or trying to make these dietary modifications. They're all trying to facilitate improved digestion. The reason they're doing that is because they find that they get less inflamed when they have better digestion. So whether you're working with a nutritionist or a naturopathic physician, a lot of our goal is just trying to get back into those foundational basics, so that way we don't inadvertently lead to, really this secretion here. I tell people, whether it's rheumatologic diseases, the new autoimmune conditions, whatever it might be, my goal is to kind of meet them right where they're at, where I can try to prevent this signaling from happening in the first place. They enjoy hearing that because, yes, that Humira, that immunosuppressant, is absolutely protecting their joints. It's protecting their body from, destructive damage. But if I can get closer to finding, an area in their environment that I can have an impact, it's usually here in the digestive tract. That's why I kind of jumped at this slide really fast, to kind of try to help facilitate that question.
This is really powerful information because, the gut-brain axis has not revealed itself in any other condition like now with COVID. And what you are describing is totally makes sense, especially due to this article that was published. So let's have you, are you going to talk about this now, or should I go to the next question? Okay, go ahead, please.
Well, yeah, I mean, it's just, I think this is the challenging part with research, like kind of you alluded to. It's like, where else have we seen kind of something hit multiple different systems all at once? And then, we have to kind of say, okay, every individual person is different. So, we could be having situations where we know that, like, if someone's under high stress, they don't get a lot of sleep, just before COVID, it would reactivate their EBV. And we would use, immune balancing principles, try to get them back into a better sleep-wake cycle, try to help them de-stress, try to, bring more antioxidants and those type of things into the system to try to down-regulate that persistent infection. It's the same example when someone has a herpes outbreak, right? They're under a lot of stress, they get a cold sore, they take an antiviral medication to try to arrest that viral replication. And, and then they also have to get better sleep, and they also have to get better, immune health. We are starting to see, this implication of a persistent viral infection taking place, the antigens being present in the body. And so that's where, it's just one of many factors taking place in that gut microbiome. So, we have patients that get COVID that already have maybe alterations here. Maybe they have a history of chronic use of antibiotics. They get fungal overgrowth, they get thrush, they get, even I have patients that have had persistent, weight gain associated with being on an SSRI. maybe they need to be on something for their mental health, but yet it's having these downstream effects that we have to kind of put in context to say, maybe there's already a lack of diversity in their diet. Maybe there's already a lack of microbiome immune signaling. And so this is why you see this explosion in research around the microbiome, is that we're trying to identify what, bacteria does what, how does it have implications over here. I literally had a patient the other day, COVID history, major hypertension, and she's from the Midwest. She has a very high meat consumption in her diet. And in that high meat consumption, you run the risk of having certain bacteria in the digestive tract create a byproduct of metabolism called TMAO. And that TMAO has been implicated in hypertension and cardiovascular disease. And so we can directly measure that marker in an individual that, is maybe describing some GI challenges, has hypertension. And, my curiosity is can I make a temporary shift and change in their diet? Can I, get them into more of a vegetarian diet, a diet that demonstrates diversity naturally through nutrition? Use probiotics, help them aid in their digestive function. Can that downregulate that TMAO production? Therefore, do we start to see a subsequent reduction in their hypertension? And now we have an ability to affect, another area of their health just purely by removing that inflammatory burden of that chemical marker of TMAO. And subsequently, it makes their physician happy over at Swedish to say, oh, yes, now we can bring your beta blocker down. Now we can bring some of these things down that start to improve, better tolerance to exercise and better muscle rebuilding and, all of those things. So I've seen every single one of these situations happen. When this article came out, I literally put it on my website because I was like, okay, I'm seeing every single one of these factors play a role. And I think what's key here, when you tie this and this and this together, is this slide where we think about the immune exhaustion that takes place. When someone is having this persistent, they get COVID again and again and again, or they have these underlying infections with these latent non-COVID reactivations. I think a lot of times, I remember back in school, for example, when the debate around was echinacea something that could help someone get through a cold faster. And I think the net result of that, it basically shortens someone's cold experience, their immune experience, from like 8 days down to 3 days, right? If they still get sick, they're still going to have their immune effect, but can we use something to help shorten that effect so we don't exhaust the underlying nutrition or the underlying host immune response in a way where they start to get into an exhausted state? And this is where I see my patients oftentimes with long COVID, is they're just purely exhausted from getting sick, getting reactivated. And it's not just that they're exhausted from like having to deal with, COVID or another issue. It's because they're exhausted of dealing with all of their other life stuff. And that's where I get into those principles of talking about, stress and kind of the chronic effects of stress on the system. That I can dive into all that, but I don't know if you have another question.
So Andrew, this was really helpful, what you described with the previous slides, and I want to segue a little bit into the microbiome. Yep. Because I think some of the very practical suggestions primary care docs can give their patients are based on microbiome. So that will be the next question from my patient: which probiotics should I choose? So I know you and I had a very fascinating discussion about the probiotics. Yeah. So what do we advise our patients, especially long COVID patients or patients struggling with chronic inflammatory conditions? Which probiotics should they choose?
That's going to be a hard one, but I will say the way to analyze this is there are various testing strategies out there that we've started to use to try to identify patterns. One of the ones that I think really shows up really well, I think it's actually with research out of University of Washington, was the Archomansia muciniphila probiotic. What's key about that one is I'll bring up this picture again. Is it's a type of probiotic that is very specific to this mucus layer right here. And what ends up happening is it's I no affiliation with this company, but there's a popular brand out there called Pendulum. And you know, you go into their research around it. I think the research out of University of Washington said it actually lowered someone's hemoglobin A1C by like half a percentage point. And part of it is that it's creating a shield here along their digestive tract, because while it's a bacteria that anaerobe that eats mucus, it helps facilitate your body's production of more mucus by the goblet cells. So we actually see a net effect of increasing this mucus layer here. And I think any kind of probiotic that facilitates, you know, kind of I think of probiotics as terrain modifiers. So we see you know, when someone has a C. difficile infection, the balance of lactobacillus and bifido and even Saccharomyces boulardii have been researched to help facilitate kind of that reinfection with C. difficile. I think of your probiotics and prebiotic material, fiber, for example, the Archomantia muciniphila really loves blueberries and pomegranates and, you know, phytochemicals that act as that prebiotic substrate to help facilitate that natural, you know, maintenance of that particular anaerobe. And the whole point of it is that it's not like a numbers game. It's not like billions and billions of probiotics. It's, do these probiotics help alter the immune signaling locally in the GI tract? Similarly, you look at the studies around Lactobacillus reuteri and Lactobacillus rhamnosus. They do much better pH balancing effects in the vaginal tract. Again, they're acting as a terrain modifier for the prevention of someone getting like a vaginal yeast infection. In my work with like my HIV population and the HIV-induced gut enteropathies, we see, you know, much more opportunistic infections that can show up because of their historical use of things like antibiotics and subsequently leading to yeast infections, thrush, those type of things. I think of most of these probiotic tools, as long as you're in a zone that has a diversity of lactobacilli and bifido. Some of the strains I'm starting to see in research, we have one that I can't remember the name of it, but there's one that's very specific to visceral hypersensitivity. There's some that are very specific to that gut-brain axis that we looked at. So, you know, there's a various supplement brands out there and companies like that, but, you know, the ones that I've seen, you know, start affect that gut-brain connection, I think I like a lot in my long COVID patients, but I also like it a lot when I'm trying to help them transition. Let's say we have a clinical reason to say, let's back off of your Zoloft, or let's back off of your citalopram, because maybe they're having consequences of weight gain or other challenges with those medications. I think whether you use probiotics as a terrain modifier, I also think of it as like, are we creating an environment that is hospitable to healthy bacteria? And one of those things is why I tie into the mind-body medicine principles. If we see gut alterations just purely, you don't even have to give someone a probiotic if you can get them into a more mindful, restful, you know, nervous system state. Because if they're not, they don't produce the right components of stomach acid, they don't produce the right enzyme profile, they don't get the motility, they don't get the movement of their bowels, they don't get the release of bile. My patients with inflammatory arthritis, like psoriatic arthritis, I see much better improvements when they move to a vegetarian diet temporarily, and they get, you know, I try to use herbs and tools like berberine or very bitter herbs to try to help facilitate bile release in the liver. Well, that bile is necessary for that additional antimicrobial action, you know, in the digestive tract. Specifically, if we think about our IBS-D patients that we give rifaximin to, that specific medication, rifaximin, for small intestinal bacterial overgrowth or IBS-D, is actually activated by bile. So if someone's bile, or they don't have a gallbladder, or they don't have some of these things, I see that a net consequence is of this overgrowth picture, this dysbiosis picture. So I kind of expanded out to answer your question of not just probiotics, but can I use something else to facilitate modifying the terrain of the GI tract? And this is where I think we had a conversation around, you know, quercetin. There's a lot of great quercetin studies out there around its anti-inflammatory effect, its mast cell stabilizing effect, both in the endothelial layer of the cardiovascular system, but also locally in the GI tract. And this is where I start to see, if I can, even if I reference this histamine release here, there are certain foods that we know release histamine locally in the GI tract. If I can kind of quell this inflammatory picture here through, quercetin or glutamine or, better digestive enzyme support, so I'm breaking down these things. I start to see that the system starts to get away from a diarrhea picture and more of a full and complete breakdown of their food and better general assimilation. I have a subset of my COVID patients, particularly in the mast cell disorder realm, that or maybe a chronic allergy state, or they get they get headaches, they get migraines, they get basically anything that where they get very histamine intolerance. I do little trials of the DAO enzyme, diamino oxidase. There's some susceptibility for some patients that just have deficiency in this particular enzyme locally in the GI tract, and that enzyme is very helpful for breaking down food derived products, or histamine derived, or sorry, histamine from food derived products. And if I can lower that histamine response, subsequently, I have actually patients have less pain. I have patients that have more mental clarity, right? We sometimes we see our long COVID patients have this like strong histamine response and they can't sleep. They get kind of like a insomnia. Maybe they take Benadryl, but instead I try to find other ways to lower that histamine response through these examples I just gave. And just another example of a modifying the terrain. Um, so I would say definitely I'm liking the Archomantia, Mucinophila. I like a good spectrum of Bifido and Lactobacillus, but I really also have to look at it in the sense of, well, they can't stay on probiotics forever and ever. I try to get them into a functional GI system so that way they don't have to work so hard by taking supplements. I think that's the big take home is these tools, just like any tool, meant to be temporary, but then what can you do to facilitate that maintenance through nutrition, healthy eating, those principles.
I think these are very practical tips. And what I walk away from this is quercetin to reduce the inflammatory state, diamino oxidase to reduce the histaminic state. And I'm going to now link this to my next very important question, and which is we often advise patients to go on an anti-inflammatory diet. And you talked about the plant-based diet, which you already partly answered this question, which is decreasing the consumption of meat and going on to a plant. I would even go on to say plant-forward diet. So can you talk a little bit about that, about in particular the role of anti-inflammatory diet, not only in long COVID patients, but we often have patients dealing with autoimmune or rheumatological conditions. What role does anti-inflammatory diet play? And also, I'm sure you will comment on dairy consumption as well. So if you can talk about that.
Sure. So I think the challenge is a lot of times I have patients come into my office and they lead with, I want to do a food allergy test. And I have to kind of recalibrate that for them to help them understand, that it's a different principle taking place when we think about dietary modification. I still use my tried and true, elimination diet where we, say, okay, let's look at what you're generally consuming. Let's say it's a diet that has some of the ones you mentioned, dairy, wheat, corn, nightshade vegetables, some of the common hitters out there. I try to tell people that, you're going to be more susceptible to inflammation from your food if you're not completely digesting it, if you're not fully breaking it down. And so while on the surface level, you can say to somebody, let's eat an anti-inflammatory diet. Let's try to, whole foods, well-balanced diet. That sounds really good in principle. Problem is, I think most people say, well, yeah, I am eating, nightshade vegetables, and that's a whole foods diet, but yet it seems like every single time I have a tomato, a potato, an eggplant, I get joint pain. And I try to describe to them and said, okay, well, what we'll do is we'll take a temporary removal of that particular food group. Not that I want to get them into a long-term restrictive diet that can unfortunately, feed into, psychosocial issues, food, eating disordered eating, orthorexia. But I say what we need to do is we need to let your immune system not see this particular food for a period of time. I need to make sure that you're really fully, completely breaking down your food. Let's eliminate it for a period of time. And let's work on these principles we just talked about. Maybe I'll use some of those tools, probiotics, quercetin, digestive enzymes, just to make sure that we're getting full and complete breakdown of the foods we are eating, even if it's a kind of a blander diet. They start to see, oh my gosh, my skin is clearing, my joint pain is getting better, I have more mental clarity. They start to feel really good. So, very easy to subscribe to the Mediterranean, those types of diets. But I say, in particular, you're probably reacting to the foods that you eat the most. We are all creatures of habit. We like to eat the same thing. We have our comfort foods, we have our safety foods. But we need to kind of speak to diversity and rotation in our diet because one, it helps foster and improve microbiome balance. It helps facilitate getting a diversity of nutritional, components. And then it also helps give our digestive system, specifically our lymph and our immune system, a less of a triggering response locally in the GI tract, which, if I go back to, this picture, the whole point with this picture here is that it's this activation of this TNF alpha, the IL-6, IL-1. If I can get this, if I can prevent this from happening, I can treat most autoimmune conditions, most inflammatory conditions, just purely principally in the sense that I'm creating a stronger shield here in this GI tract. And then, we say, okay, let's say we need to eat a diet that is, not encumbered by particular food sensitivities because maybe it's dairy. Unfortunately, we sometimes don't all have the enzymes to help fully break down lactose, or we have these proteins like a casein or whey protein, or we think about why we kind of colloquially joke about like gluten, right? Oh, go on a gluten-free diet and see, even if it's a non-celiac, gut enteropathy, it's specifically because some of the food that I think we consume in our diet either is gluten, just a really difficult molecule to break down. And so it needs a lot of functional, chewing your food, full and complete hospitable environment to break it down. And it just happens to be interfacing with the immune system for a very long time. And so, I'm not sitting here knocking wheat or gluten in general, but it's just that it's interfacing with our immune system for too long. So I really like to speak to the rotational aspects of these things, speaking to the awareness of someone's body about how they are reacting to something. So that's why the point of elimination diet, in my opinion, is still one of the more gold standards if they can tolerate it. If they can't, we've got tools now. We've got, like I mentioned earlier, the different enzymes that help facilitate full and complete breakdown of these things. When you're reading a label on a supplement, when you're looking at, the enzymes, you'll start to see various pHs that some of these enzymes will have more of a profound effect in. And part of that is because certain foods get broken down better in a acidic environment, a, base diet, those type of things. So, otherwise, if I want to help someone, short term, whether it's lose weight, de-inflame, whatever, I move towards more of that Mediterranean kind of Euro diet that's really vegetable forward, like you stated, because it really helps facilitate, just resetting the system a little bit. I think most people have to have that bodily awareness about how these foods are affecting them. And that's where I think it's just a personal one-on-one conversation with most people is just, let's explore it. Let's find a pattern here that that we're running into, and then let's modify it and change it. But don't do it in a restrictive way where we start to feed other problems in the person.
Thank you very much. I loved how you described the gluten sort of related immune disruption. And that's a very basic understanding of what it is doing, in addition to what casein is doing. So thank you for explaining that. I want to now switch gears and go to another symptom cluster. And we see a lot of chronic fatigue. We see a lot of post-exertional malaise. This is often linked with brain fog. So with worsening malaise, with worsening fatigue, they will have more cognitive symptoms. What is your approach, and what are some of the strategies you use to manage this chronic fatigue, PEM, and brain fog kind of stage?
So that's a great question. I'm kind of, this is my wheelhouse. This is where I like to have a lot of it. So this is a study I came across. I think it's in the Netherlands, and it really speaks to this concept of approaching fatigue and these cognitive complaints from that biopsychosocial model. I think I remember a slide, a year or two ago on one of the long COVID lectures that you provided that said that there's not one unique way of approaching long COVID. It has to be reaching it from a mental health, physical health, kind of a diverse intersection. And one of the biggest things that I see is that this concept of fatigue, we have to kind of recognize the person and what's going on. You know, it's kind of like recalibrating, when someone's never been faced with an illness before, we run into this, the individual with a new diagnosis. There's a lot of uncertainty that happens sometimes when their body has shifted from where it was at before versus where it's at now. And so we have to be mindful that when we give someone, a diagnosis, that it can be scary, it can feel unsafe, particularly if there's not really a clear plan in place. And what we all observed in the process of dealing with this pandemic is there was a lot of fear, there was a lot of anxiety. We didn't know how it was we just didn't know. And so the downside of that is that chronic stress leads to, when we think about when someone has like an initial injury, they start to have that initial pain experience, or maybe it's a fatigue experience, and they don't know what to do with it. And then they get all this like outside information coming into their brain. They hear it in the news, or they hear it from their friends, or they hear it from their doctor. And there's this potential for negative affect. And this, I mean, it's scary for some individuals with what we all experience with COVID. And my concern is that when they get into this cycle where they start to fear things and they start to fear what's going to happen, they start to avoid certain things. They maybe isolate, and you see what happens with the fatigue principle. They can't use their body the same way. They start to, they can't exercise quite the same, and it starts to perpetuate this potentially. So when I work with my clients as a physician, we really have to think about, what we can do to facilitate not causing additional fear, and to help assist this person to get through that fatigue experience. And it has to be, in the words that we say, in the communication that we do they have enough social support? My advocacy for a lot of times is to get people into if they have the opportunity for FMLA, that I think it's so important. A lot of the talks I've heard for a lot of patients, it's like we as providers are here to advocate for their ability to rest their body. I've got, for example, some of my examples of patients that are just completely fatigued and tired. They happen to work in HR, and they have a very difficult time working in HR because all of the health issues that they're having to deal with their coworkers, but they themselves are feeling kind of the weight and heaviness of that. And yet here I am asking them to say, I need you to take time off of work so your body can heal, so you can rest, so we can rebuild, an exercise strategy, or a nutritional strategy, or whatever it might be. And I think this picture right here is what we just replace the word fatigue with, or pain with fatigue. I think wherever you intervene on a particular patient to ask this question or to answer this question, I think it's teaching them that whether you introduce melatonin to help with the neurocognitive complaints associated with the cytokine storm in the brain, or to help them, or you give them a CPAP, or you help them with that to help break that cycle. You get them into counseling to help understand that the loss or the fear that they might be experiencing. We have to kind of reorient them that we are seeing data that says that people do recover, that it just based off of time, sometimes alone, you do nothing, maybe the person will start to get better. But that's hard if they get into a mindset that is negative thinking. When I work with clients, I use a lot of the polyvagal theory, and I use cognitive behavioral therapy to try to help them get into a more mindful state so that they can get out of that sympathetically charged state, which further exhausts them. Um, so anyway, anywhere where you intervene on this, for myself, my background in exercise science, if it's a fatigue state, I'm looking at finding ways I can, kickstart them. It might be the use of a B complex or a vitamin set that's geared towards mitochondrial function. We had the study out in, I think, January, February of this year that had the biopsy of the muscle that showed, reduced oxphos capacity or reduced VO2 max. Some of that has, I think, in my opinion, all of a sudden I've got trained athletes that are just tanked and fatigued. I have to recharge their system again. I have to get them in that good nutritional state where we say, okay, we might use CoQ10, we might use B vitamins, we might, it's not permanent, but it's just a temporary thing to kind of kickstart their ability to just feel just a little bit better. But if they start feeling a little bit better, then I say, okay, now take that opportunity to do some simple weight-bearing exercise. Get 30 seconds in of do a little bit of interval exercises, 30 seconds on, 30 seconds off, or, only go 10 minutes down the block, 10 minutes back. But you don't put them into a state where they fatigue or exhaust their oxphos capacity, for example, or their mitochondrial capacity in their muscles. And then they start to say, hey, I did it, and now I can let my body recover, and you're reteaching your body to recover again. So that's what I think we have to work together in tandem, whether it's physical therapy or the nutritional aspects. You have to have the psychological part of it to help them break that perpetual cycle of fear or fatigue, because it's debilitating. But I do find that when I can approach my patient at lowering their stress, I see that it starts to lower their inflammatory response. I start to see less neuroinflammation as a response of that. I think and if I can get less neuroinflammation, I start to get less of that brain fog. Right. I start to get, they can start thinking more clearly. They actually realize that the anxiety, the depression, the inattention that they were experiencing is not them. It's the consequence of the inflammation happening in their body. And so that's where we can break that cycle from that cognitive impairment, the brain fog, the fatigue side of it. And they can start to see, oh, actually, I see, when I eat gluten, I feel tired. It's because I'm probably getting an immune signaling in my digestive tract that's going to the periphery and going up to my brain. And maybe I'm one of those individuals that's had prior, vascular damage or blood-brain barrier disruption. And so for me, I eat gluten, now I'm tired. We have to kind of teach them to be paying attention to these issues. And, I really like this slide. I've seen it on some of your slides. We have to kind of say, I look at this and say, are we doing something to, work here and work here? And in my background with exercise science, I'm a big believer of trying to get people to move their body, build muscle again, make sure those things are there so that way they can do those activities again. I think a lot of times our chronic fatigue or long COVID patients have just unfortunately been too debilitated for too long that they atrophy, they lose that mitochondrial effect, they lose their muscle mass, and it's really hard to build that back up again. So you just have to kind of find, where whether it's cognitive behavioral therapy or nutrition or exercise. You just got to start somewhere, and then you inch forward in all of these realms altogether.
There is a question, Andrew. Someone asked, Gerald asked, does the mRNA of the virus or the vaccine interact in any way with the mitochondrial DNA in the cytoplasm? So do you think the vaccine or the mRNA of the virus, so we do have evidence of virus persistence, but do you think the vaccine can interact with mitochondrial DNA?
I've not really seen that. I don't have any way I can qualify that. I would say though that I think what we need to help support patients with is there's, in my opinion, with the use of like a vaccine, there's a benefit of a controlled immune response to something like an administration of a vaccine that we can assist our body's immune response to see and witness. Versus when I have my patients have like a very wild infection, they get an unregulated dose response to maybe the virus. And I've had patients that have really subtle COVID infections, and then I have some patients that just seem like they get hit really hard by a particular strain. And in my opinion, when I'm trying to support my patients, defensive response to these things, remember it's the mucous membranes. I think the same person actually asked me a direct question about the IgA response and the mucosal surface of the body. It's the same reason that I think we need to, have a balanced immune response by having all these other nutritional things we talked about, but also keeping our immune system strong by keeping our stress low. And then our body can have the healthy immune response to these things as we get, whether it's a vaccine or an infection.
I love that you talked about the diet, you talked about what is happening at the cellular level and some of the supplements. In the interest of time, I'm going to actually ask you about acupuncture. Some of the other functional medicine things that you use, that is one question that I have. Where do you advise acupuncture? And my second question is, do you use low dose naltrexone? And what has your experience been with this medicine, and when do you use it?
So I know I don't have a specific acupuncture slide, but I'm gonna show this one here. This is when I do like biofeedback and I do mind-body medicine training. I demonstrate what it is to calm the nervous system by getting into using maybe breath work, for example. So my partner is an acupuncturist. She's co-founder here of my office with me. And what we try to work together in our patients, we actually have a couple long COVID patients. I'll speak to the patient's ability to calm their nervous system, getting into more mindfulness, more breath work training to try to improve their circulation in this example, to their brain. But when they do that, they learn those mind-body medicine skills. When they get into acupuncture, they find that they are literally laying there on the table with needles in, and it forces you into a mindful state. And we get this neuro calming effect of acupuncture, but then we get a local effect when we start to use the needles in particular areas of either pain or areas that need circulation or areas that need improved blood flow. So the application oftentimes in an acupuncture session is going to be including things like a TDP lamp, a heat lamp to promote circulation and blood flow to a particular area. It's maybe using cupping and manual therapies and massage techniques to try to shift and apply blood, moving the blood and the circulation in the area. My wife is an acupuncturist. She oftentimes, it's a different language, but in traditional Chinese medicine, they'll describe, through the assessment of their pulse, their tongue, an awareness of where this person might be deficient. And a lot of times you'll hear words like qi deficiency or blood deficiency. And really what that's speaking to is it's a lack of like circulation. It's a lack of blood flow. So as someone that might be anemic, might have low iron. Well, we know that that's going to cause tachycardia. That's going to cause potential, in extreme cases, edema, hypotensive situations. So they'll read that from, analyzing what's going on with the person and say, you might need to go get blood work. You might need to go investigate this as a factor of your symptoms. And that's why we like working in that way, in an integrative way, is because, whether it's an acupuncturist reading the constitution of a person, the byproduct of how physiology shows up in somebody, that's really what it's the power of seeing an acupuncturist is, or a traditional Chinese medicine provider is they're looking at these signals in the body from a Western medicine model. My wife, very classically trained as a doctorate of acupuncture, even, they'll have like a hepatologist and a gastroenterologist and a cardiologist in their training come in but they apply it through the lens of what we see in acupuncture. So again, it's principally if we can lower the nervous system response, if we can get someone back into a healing state through, more of a parasympathetic state, we find that their heart rate slows down, their blood pressure improves, they get stronger immune response, they get less inflammation, they get better digestive function. All of these things are centered around improving your body's interaction with its environment. And that's kind of the take home for me when it comes to the use of integrative medicine. It's can we get to a process where we are really facilitating that for the individual to be, then they get better sleep. And we all know that if we get better sleep, we can think clearer, we can feel a lot better in our body. I do use LDN, low dose naltrexone. There was a really cool study. That's why I brought this slide out. I'll see if I can get this over to you, but this one was really interesting. It came out in February of 2024, where they're pairing LDN with, NAD. I think this just speaks to the concept that, with those patients with persistent fatigue symptoms, I use the LDN to really help quell the microglial inflammatory state in the brain. And if it means that I can remove a little bit of that brain fog or a little bit of that pain, it's not the only thing. Like what I'm trying to emphasize here from an integrative perspective is if I can get them just a few steps closer to not being fatigued, it might allow me to then allow them to focus on exercise, or allow them to focus on the counseling that they need, or working on these better lifestyle choices, behavioral health choices that help really create a more sustainable effect long term. I have seen people not do well with it though either. It really depends on that individual's picture. I see kind of reverse effects. Some people get really bad nightmares with it, but I do like it if it means that it gives me that edge. That means I can break the cycle around, if it fits in here, and if I can use that LDN to reduce their fatigue, or improve their pain response, or make them just a little bit less tense, I will absolutely use it but then I shift it towards, one of these other sustainable therapies.
So LDN is something that you use short term. You're not using it long term. You want to use that as a sort of step up, but then you step down and you take them on lifestyle changes to help improve and sustain their symptoms. That's really helpful and very useful for all of us. I was going to open up the floor to questions. If people have any questions? Please feel free to put it in the chat. If not, Andrew, do you have anything to add?
Yeah, I mean, I just have the therapeutic order here. I mean, I think what's key is recognizing that, what we try to preach at Bastyr, the naturopathic teaching school, and with my clients is I very much tell them that, the care that we provide is meant to help intervene in areas that are hard to manage. I work on these bottom layers for people all the time. But I am not opposed to giving someone, lisinopril or a statin, or, a higher force intervention, because I think it's important to recognize that, in my goal of doing no harm with somebody, I need someone to feel safe. And the COVID pandemic, that's why we offered the COVID vaccines at our office, is, it meant that people felt safe in knowing that they had an opportunity to prevent, bigger term consequences. I think we could be dealing with a lot harder long COVID situations had we not had as high utilization as we did here, at least in the greater Seattle area. But you know, I think it's important though that when someone is at a high force intervention, we have to create opportunity for them to work down the ladder. And I think that's what's important about working in an integrative way. It's why I like referring my patients to, you know, physical therapy. I need them to exercise. I need them to feel strong again. That's why I send people to massage or acupuncture, is they need that subtle treatment. They don't need the high force treatment. Sometimes these things can have implications. And so that's where I fit in. That's where naturopaths should fit in. It's to help them move up or move down. We don't always get the opportunity to assist our patients with that. And, you know, I recognize the why, but, you know, I think this is the value of working, you know, collaboratively together in those ways.
Thank you very much. And this was so very informative, Andrew. I think, you know, we all of us learned a lot, and they are very practical steps that you gave us, especially with the supplements. That is where I struggle a lot. So I think it was very, very helpful. I want also to take a few minutes to make a couple of announcements. We have our first long COVID symposium coming up at the University of Washington on October 12th. And we have shared on the group email the flyer for the event. It's called RISE. The event is open to both providers and to patients. And we also have a lovely concert by a nationally known cellist who himself has long COVID and who is coming to perform for both patients and for the physicians. That is one thing. And then the other is on October 11th, we have a fantastic performance by the same cello player. His name is Joshua Roman. It's at the Crossroads Community Center in Bellevue. It's on October 11th from 5 to 7 p.m. It's free for everyone. And this is a more informal event where his musical performance will be followed by a reception where people can actually interact with him. So please, you know, register for both these events. Nick, please share the other flyer if you have it. If not, we can send it out in the email. With that, I really want to thank Andrew. Andrew, this was a fantastic presentation. We learned a lot, and I know that people will want to have your recording. So we will try and get it out as soon as we can. Thank you very much for giving us time today.
Thank you very much for having me.